Hello, my name is Allison Laramore, and I'm going to be presenting over Hodgkin's disease or Hodgkin's lymphoma. So, the overview and pathophysiology of Hodgkin's lymphoma is that it is a form of lymphoma and is rare. It is a malignant type of growth or a mass. It makes up about 11% of all lymphomas. It targets and attacks the lymph nodes and spleen. And what happens is that there is a proliferation of abnormal, large, multinucleated cells called Reed-Sternberg cells, which are located in the lymph nodes. The normal structure of the lymph nodes is destroyed by hyperplasia of monocytes and macrophages. That's what happens during this disease process, and the cellular origin is through B lymphocytes, which is in charge of causing the DNA destruction and mutation. The extent of disease is localized and or regional, but it could be widespread, which is more deadly prognoses. And also, I am so sorry if y'all hear fireworks in the background. It's 4th of July. Yeah, I will try to talk louder so that is not a distraction. Unfortunately, I cannot do anything to stop that. Okay, so continued pathophysiology and disease characteristics. The exact cause is unknown, but is believed to be acquired by genetic mutation in the DNA of a white blood cell called a B lymphocyte. Several factors aid in development, which is infection of Epstein-Barr virus, which is EBV, genetic predisposition, which has to do with the B lymphocyte and the genetic mutation, and exposure to occupational toxins is another factor. Adult men are twice at risk of acquiring Hodgkin's disease, making it a bimodal age-specific incidence. And to further go on that, this disease is most commonly seen in people aged between 15 and 40 years old. Average age is about like 32, 30. And then after that, people, usually adult men, age 50 and up, have a higher risk of getting the disease, which is why it is a bimodal age-specific incidence. But it mainly occurs in adult men, either somewhere around their 30s or 50 and up. So the main diagnostic feature is the presence of the Reed-Sternberg cells in a lymph node biopsy. The clinical manifestations of Hodgkin's disease is that the first sign, there's usually a painless enlargement of lymph nodes in the neck and armpits. Other signs are fever, malaise, loss of appetite, weight loss, elevated heart rate, which is tachycardia, and night sweats. And usually it's like really bad, heavy, drenching night sweats. The common lymph node enlargement locations, there's the cervical lymph nodes, which is the most common, and then you can get a mass in the mediastinal lymph node, which is the second most common, and then there's the axillary, which is your armpits, and the inguinal lymph nodes, which is it's in your groin area. And what happens with the lymph node enlargement, it's called lymphadenopathy, which affects discrete nodes that remain movable and non-tender. Enlarged nodes are not painful unless pressure is exerted on adjacent nerves. If it does spread, it usually spreads to the liver, spleen, and lungs. Risk factors for people, either if they acquire this, they're at higher risk of acquiring this disease, or they're at higher risk of having complications if they get this disease, are people with HIV, people who have mono, and people who are immunocompromised. So the long-term survival exceeds 80% of all stages in the initial diagnosis. Initial findings of fever, night sweats, and weight loss are called B symptoms and correlate with a worse prognosis. The prevention is unknown. There's no evidence on figuring out how to prevent this, especially when a lot of this could be caused by genetics. Control when it comes to other things that could cause it as a possibility, safer working conditions to limit exposure to toxins in the workplace, like people that work in like the ironing industry or iron industry, or I don't know, like coaling industry or hard labor type of jobs where toxins are pretty evident. Regular checkups and examinations with a PCP at primary care provider, and report any symptoms of concern as soon as possible to your primary care provider, and adhere to the prescribed treatment regimen if you do have the disease. So the treatment for Hodgkin's lymphoma is, if the disease is diagnosed in an early stage, radiation may cure it. If it's more advanced and involves more organs, then chemotherapy is usually recommended. Other treatment options are bone marrow transplants and monoclonal antibody treatments, and then there's symptomatic treatment like Tylenol to control fever, and maybe anything else to, like, over-the-counter pain meds to help control pain. But that is it for my presentation. I hope y'all enjoyed, and thank y'all for watching.